The fight against coronavirus is in its second year, and in the last 1.5 years, there is something new that world learns about the virus almost every week. New variants, new symptoms, and its after effects. One such after effect putting patients and doctors to panic across India is the black fungal infection, scientifically called mucormycosis. The rare fungal disease is hitting COVID patients as the healthcare system continues to reel under massive pressure. As of 19th of May, at least 7,250 cases of black fungus have been reported in India. Hospitals are now facing a shortage of medicine which is used to treat this fungal infection. India's health ministry said that it was looking to rope in more companies to produce the anti-fungal drug. 5 additional manufacturers have been given license to manufacture this drug, and production by existing 5 manufacturers has also been ramped up. India also plans to increase its import of anti-fungal drug to fight the black fungus. On Thursday, the government asked all states to declare black fungus as an epidemic. The Health Ministry has asked states to list it under the Epidemic Diseases Act 1897. This means all confirmed or suspected cases have to be reported to the Health Ministry. All government and private health facilities, medical colleges have been asked to follow these guidelines issued for screening, diagnosis and management of cases. Delhi has set up dedicated treatment centers for black fungus in the hospitals, 3 hospitals to be specific. While the news of this symptom has sparked widespread alarm, it is important to understand that it does not affect everyone. It does not. So let's understand what causes this infection and why it is suddenly being reported in COVID-19 survivors. Mucormycosis or black fungus, a rare fungal infection, is caused by a group of molds called mucormycetes. The black fungus affects the sinuses, the brain and the lungs. While it has been observed in recovered COVID patients, it mostly affects immunocompromised patients, those with diseases like diabetes, cancer and others. According to the US CDC, it is most common in diabetic patients. So what are the symptoms of black fungus? It ranges from a headache to even nasal congestion. Patients typically have a stuffy and bleeding nose, swelling and pain in the eyes, a drooping of eyelids and often loss of vision. If diagnosed late, it even has a mortality rate of around 50%, so early detection is essential. Prior to the pandemic, the infection was very rare, but the sudden rise can be attributed to multiple factors. One is the use of steroids in COVID-19 patients. The black fungal infection is being triggered by the use of steroids. Exposure to wet surfaces also increases the chances of infection. While the frequency of this fungal infection is on the rise during the second wave, one way to stall it is administering the right dose and duration of steroids. When detected on time, it is often treated with an anti-fungal intravenous injection. In the Indian state of Bihar, 4 cases of white fungus and white fungus infection have also been reported. This infection is considered even more dangerous than the black fungus. Experts say the white fungus infects lungs as well as other parts of the body, including skin, stomach, kidney, brain, mouth, and the private parts. For more on this, we spoke with Dr. Rajesh Malhotra, the chief of COVID Center at New Delhi's AIIMS Hospital. As the overall infection figures continue to dip across India, a new challenge of black fungus cases is rising. So we asked Dr. Malhotra to elaborate on the reasons behind this sudden jump in fungal infections in COVID patients. Listen in.
That the black fungus selectively attacks the diabetics, the people whose immunity is suppressed, people with kidney disease, people with cancers, especially blood cancers. And this wave actually, one is that the numbers have been too high. So if you look at the number of cases, which we had. So even 0.02% incidence will translate into a large number. So that's problem number one. Number two is that we have had steroid use like never before in this, because we have seen that steroid and oxygen are the only two really life-saving treatments in COVID. So this particular time, I think a large population received the steroids, and very often at an inappropriate time, in an inappropriate dose, and for an inappropriate duration, with the result that the sugars really skyrocketed. Those who were not diabetic also experienced high levels of blood glucose. Now we know that the black fungus attacks people once, even after they have recovered from COVID and have gone home, and maybe anything from 2 weeks to 6 weeks. And that is the time when, if you have continuously high blood sugars, or you are still suppressed, or many patients are being discharged on small doses of steroids, and that those are the cases which become very, very prone to get black fungus, particularly if they don't take precautions like avoiding dust, avoiding the soil, avoiding the other sources. We know that the fungus is everywhere, but it is particularly found on decaying wood, decaying food, decaying vegetables in the soil. So you have to be very, very careful. And that's another place where, wearing masks, gloves, and shoe cover and all, if you're going outdoors, or particularly in your garden, would be very effective.
WION is now available in your country. Download the app now and get all the news on the move.